Hello and welcome everyone to the 6th webinar on BioVigil's Webinar Series, A Tale of Two Hospitals. Infection preventionist Maryann Smout from Bingham and Susan Summers, Director of IP from San Gorgonio, will share stories with us about increasing hand hygiene compliance in their community hospitals. This is a panel discussion, and I'm your host, Amanda Holden-Sinisi. Before we get started, I do have a few housekeeping items that I'd like to share. Your line is muted, so you don't have to worry about muting yourself. And this is a panel, so although I have received questions via email from some of our participants, please do feel free at any point in time to share your question in the QA box, and we will make sure that we're able to answer it during this section. And we will address, as best to our ability, all of those questions during our presentation today. For those of you who are with us for the first time, welcome. And welcome back to those of you who have been with us before. We're very happy to have you. Just as a quick overview, BioVigil's webinar series features key opinion leaders who are making a significant impact with patient safety and experience in hospitals. Speakers will share data insights and best practices that have made their organizations best in class in the culture of staff and patient safety and driving exceptional patient experiences. And now I'm privileged to introduce our two speakers. And I'm trying to move the slide, here we go. The first one is Susan Summers. Susan is an RN, BA, MBA, CAHP, and CPHQ. She's the Director of Infection Control and Risk Management at San Gorgonio Memorial Hospital and has over 40 years of combined experience in nursing, infection prevention, and leadership. Susan earned her MBA from the University of Redlands in California, and her personal achievements range from Student of the Year to Health Fitness Instructor, so she's very well-rounded. Susan is very excited to work in a hospital that has access to the latest technology to help drive her efforts forward. Susan, can you say hello? Okay, she may be on mute, and we'll move on to Maryann. Maryann Smout is an RN and a BSN and has worked as the primary infection preventionist for a 25-bed critical access hospital in Blackfoot, Idaho for the last 3 years, which is actually called Bingham. She has infection prevention experience in employee health, long-term care, and ambulatory care. And she was instrumental in implementing BioVigil. Following the implementation, hand hygiene increased by 16%, and other notable accomplishments include increasing acceptance of flu vaccination by employees by 36% and decreasing the number of hospital-associated C. diff infections by 50% over a 2-year period. Maryann, can you say hello to our audience?
Hey, everybody.
Fantastic, thanks. And Susan, are you there? Are you able to unmute your line? Susan, maybe you can try through your computer audio. Okay, I'm sure Susan will be able to join us here very shortly. So as a quick overview, I'm sure that all of you are here because you're curious to know how these community hospitals have had such great success with increasing their hand hygiene compliance and some of those fantastic outcomes that I mentioned over email. So while Susan is working with her audio, we will first start with Maryann. Maryann, if you could give our audience just a quick overview of your hospital and how BioVigil has helped you be successful.
Sure. Our hospital is a little big hospital. We're just a 25-bed hospital, but we have our wings out in skilled nursing, many clinics throughout the valley, and we treat a variety of patients, and I think it's like a 30 to 60 mile radius. So we have a big outreach there. We implemented BioVigil in 2016, the end of the year of 2016. And we had a large increase in hand hygiene at that time, and we've increased hand hygiene by 16%. And then we also notably increased patient satisfaction by a large percentage there as well. When we implemented BioVigil, we put hand sanitizer machines in the room because we currently did not have hand sanitizer in the room. And then we also added a member of our team who would go and meet with every patient on a daily basis to address any needs that they had. And we also talked to them about BioVigil. So there's a little bit about our story, I guess.
No, that's great. Thank you so much. Maryann, since one of the things that you saw after the BioVigil implementation was an increase in customer satisfaction scores, do you think that would have changed or not changed had you not implemented BioVigil?
Let's see. Okay. BioVigil was very key in doing that. For years prior to BioVigil, we had been sitting between 50 to 37%, and that's just for one question. That's for the question, does staff perform hand hygiene before they provide care? And we had just been consistently at the 40% mark with our patients saying that we washed our hands before we provided care. And this was after we tried to do, secret shopper, hand hygiene, and we would do interventions at the point of care, and we just were not getting, our patients weren't seeing that we were washing our hands. So we added BioVigil, and I don't think we would have had that dramatic of increase in as short of amount of time that we saw without BioVigil.
Okay, thank you so much. And was this an effort that was simply put forth by the infection prevention team, Maryann, or do you have other supporters in the hospital that you think are necessary to your success?
You absolutely need a team of people. BioVigil was actually brought to me by my boss. So administration actually brought BioVigil to me. As the hospital was wanting to do something more, we were very focused at that point in time on patient satisfaction scores. And one of the areas that could be addressed was hand hygiene. And that was something that the hospital administration felt very strongly about. So we were actively looking for a solution or for something to help us increase patient awareness and increase staff awareness that we're actually washing our hands.
Fantastic. And can you talk a little bit about BioVigil? I know that in our past conversations, BioVigil often brings a lot of positive things to the hospital. Can you talk to our audience about if it makes your job easier, if it's better, if hand hygiene compliance or dealing with hand hygiene compliance is less stressful? There's also the data component. So if you could touch on those, this was one of the questions we actually had from one of our participants in email.
So as far as collecting the data for hand hygiene, that's very easy. It's all done by BioVigil. I don't have to do anything there. And then I can break it down into anything that I want. I can break it down by department, staff, person by person basis. So BioVigil takes care of all of that. One thing that I didn't anticipate with BioVigil is the amount of daily reinforcement that I need to do and my managers need to do to just reinforce our staff. And we give out candy on a monthly basis, and we just walk around randomly, and everybody who's wearing their badge that day gets a candy bar. And then we do like the star hand hygiene for the month, and they get, a gift card. And that's required like a little bit more than I thought, but we've seen sustained improvement and actually have increased our hand hygiene. We're still increasing the percentage that we're getting even after 2 years of having BioVigil. So it's an ongoing process, but I don't have to do, or have people do secret shopper anymore. That's taken care of for me.
Fantastic. If there was one thing that you could change about our solution, what do you think that would be?
Probably just all the parts and pieces. I find that we lose keys a lot at our facility, so we're always having to reassign out keys. So it'd be nice if there was maybe one less part or piece to the solution, but everything else has been pretty great.
It's interesting that you say that, because we are constantly innovating and looking for ways to make make BioVigil more efficient and easier, of course. And so I can't share any of the future innovations that we are planning on doing, but I will say that your comment is well noted. So thank you so much for sharing that. And just so everyone knows, Susan is just having a hard time getting on the line. So we're focused on Maryann right now, and we hope Susan will be able to join us here shortly. So Maryann, it's all you right now. No pressure. Let's talk a little bit about outcomes. So we know that you have gone from 35th to 95th percentile as far as increasing customer satisfaction is concerned. How important is sharing positive outcomes such as that with the leadership at Bingham?
It's super important. We report on our hand hygiene numbers to administration on a quarterly basis. That's one measure that we report on every quarter, and it goes up clear to the board. So it's super important. It's something we're watching. As I said, we're very focused on patient satisfaction here at our hospital, and our hand hygiene is directly tied to patient satisfaction scores. So it's very important.
Okay, great. We do have a question from online, so I'm going to read this out to everybody, and I think that I will probably answer this. Of course, Maryann, I'll give you the option as well. We have a gentleman from Frank from New Hampshire who said he's read some research articles on BioVigil showing compliance rates above 90%, but he's also heard that the badge has an opt-out button. Can you comment on the facilities that have reached compliance above 90%, which percentage of opportunities are satisfied with the opt-out button? Is the data made available to clients? And I think I'll take this one, Maryann, and then if you have something to add in, that would be great. But Frank, to answer your question, the purpose of the opt-out button is really for situations in which you need to really focus on the patient. So if there's a code. And so with the data, we are able to report on who has opted out, and if they're opting out too many times. And so all of that data can be delivered to the infection prevention team or whoever is monitoring the data. But those are so few and far between, they don't really have an impact on the greater than 90% level of compliance. So that's not really something that, at least in my experience here, the hospitals with whom I have worked, that has been any kind of an issue. Maryann, what have you seen for opt-outs at Bingham?
I would agree with you. It accounts for like less than like 0.5% of the number of hand hygiene opportunities. So I don't think that really plays into the compliance rate. We did just barely achieve that 90% compliance 24/7 at our facility, and we implemented 2 years ago. So it did take us 2 years to hit that 90%. We were sitting around that 88, 89% for a long time, and so we did finally hit that 90% threshold just barely, so that was good.
Hey, congratulations. That's fantastic news for you. Okay, we have another question, and this question is about the cost of BioVigil, and the person who has, Ms. Lebowski, I will email you directly after we can have a conversation about cost. And the reason we don't like to talk about cost on conference calls like this is because there are a number of factors. Cost isn't just, it's not straightforward, and so there are a number of factors that go into that, but we're more than happy to share with you the cost of our system. Okay, I have another question here online, and Maryann, I'm gonna give this one to you. We have a question from a Ms. Sanders who is curious to what approaches you use to encourage use and compliance with your hand hygiene initiative with staff. I think you mentioned a little bit about candy, but if you could offer a few more details, that would be great.
Sure, this has kind of been an ongoing process as we've tried to see what our staff finds rewarding and what makes them happy, I guess. So we initially gave out a card to anybody who hit over 90% compliance, and they could go get something from our cafeteria, like free lunch or coffee or whatever they wanted. And that was received mostly well, but some staff wanted different rewards. So now we're doing full-size candy bar, and we just pick a random day every month, and everybody who's wearing their badge gets a candy bar. And then we also do like, I don't know, star for the percentage, the top people who hit over 95%, they get a gift card. I think we're doing $25 right now on a month for over 95% compliance. So we try to do daily encouragement as well. I'm on the floor almost every day, and I remind staff who's not wearing it to put it on, and those that are wearing it, I tell them thank you, and sometimes I'll carry around little candy with me to give out. So that's kind of what we do. I think the more encouragement you give, that's nice. We've had to sometimes do, you know, the opposite of encouragement, do some write-ups and things like that. But I think if you start out with encouraging and candy and things that they like, I think that works good.
Great, that makes a lot of sense, actually. Is there any kind of a success story that you can share with us about one of your staff members or some aspect of culture change?
I think culture change is ongoing. We've really struggled at Bingham, I'll be completely honest. It's been a struggle. Staff wasn't as excited about it as we thought they would be. So we struggled, but I think we're getting there finally. Like I said, we finally hit our 90%. So I think we're getting there. I think it's just sometimes it's the long battle, and just keep going.
And I think that also depends on the culture of your hospital to begin with, and maybe some of the other things that you've had to endure with staff as well. Have you, actually, so let's talk a little bit now about the patients, because you were able to increase your patient satisfaction. Do you have any anecdotal information you can share with us as to some comments from patients or things that you might have overheard about BioVigil?
Oh, I should have come more prepared. I can't really think of anything off the top of my head. The thing that I think the patients appreciate the most is that it's easy to tell. You know, they have a light, they can look at the light, it's super easy. And we try to educate our patients when they're first admitted. And then, like I said, we have somebody who actually goes around daily to every patient room and will remind them about BioVigil and how it works. So we try to involve the patients and make sure that they know that it's okay to like call out a nurse and tell them, hey, you didn't wash your hands, you need to wash your hands before you can provide care. So I think they appreciate just knowing, and that shows in our scores as well, but just knowing that they're safe, our nurses are washing their hands before they provide care.
Okay. Can you share with us the difference between what you saw with direct observation and what you see with BioVigil?
With direct observation, sometimes people figure out who your secret shoppers are. We're a smaller hospital, so I didn't have a lot of staff to choose from to begin with. And usually it was me and somebody else. And so people would know, they would wash their hands. And then you're only getting a glimpse of what is happening while you're there watching. And to do the number of observations it takes to actually get a good idea as to what your hand hygiene rate, it's hard to do, and it's super time intensive. With BioVigil, it's 24/7. I know what my night shift is doing, my weekend shift, you know, my day shift. So I get an accurate picture for the whole day. So my numbers are actually probably better than what they were before.
It's great that you bring up night shift, because that was a question that we had. Have you seen a decrease in the use of BioVigil for those of your staff who are on night shift as well as the weekends?
Yes.
How do you manage? You're not in the office.
Yes, I've come in a few times on weekends and nights, and we've tried to encourage our staff that way. We also have, I don't know, house supervisors, and so we've kind of definitely made them responsible for making sure people are wearing the badges. And we've made it known, it doesn't matter when you work, you're responsible to wear your badge. It's part of your uniform, it's part of your job. We require it for all of our staff. It's not optional, it's part of your uniform. You wear it, you come to work, you put it on, you leave work, you take it off. So.
Okay, great. We have another question from Mr. Maxwell. Frank has asked, in regard to the high compliance rates, how critical are the alerts and reminders to sustain those rates? And is this feature used with all staff at all times or used infrequently? And how common are false alarms? So I will go ahead, Maryann, and take this one first, and then feel free to add some color from your perspective. But yes, Frank, the high compliance rates are definitely on all the time. That's one of our BioVigil's features is the built-in reminder, which is configurable, and therefore we have seen across all of our hospitals a 44% increase to compliance with those reminders. So the compliance rates would be significantly lower if the reminders were not turned on. And they are used for all staff at all times, as far as I've seen in the hospitals in which I've visited. I think there's no reason why anyone would turn those off, because that is one of our values and differentiators to our system. And there, to my knowledge, we don't have false alarms, so there aren't reminders going off when reminders aren't needed. It's a very tuned and accurate system that's based on the hospital workflow. So I hope that helps you. Maryann, do you have any experience with regard to Frank's question on reminders and or people not using the reminders?
I agree with everything you said. One nice thing that BioVigil team did for us is you guys were actually able to like show us the number of people who washed their hands after a reminder. So that was pretty nifty that you guys were able to provide us with that data. I don't think you get false alarms. One thing we did do is we did turn off the vibration because the staff was finding that to be excessive. So it just beeps now with the lights. So I think that's been a good change for us.
Okay, great. We do have another question from online, and this one will be directly for you, Maryann. Do you feel that the team effort and engagement from leadership is what's helping to increase your compliance rate?
I think a team effort is needed if you're going to see change at any point in your facility. So I think that's absolutely been very helpful. It's very hard as one person to try to change, you know, a whole environment, culture of people. So I definitely think you need administration, you need manager support, and you're going to help drive it too. But you need a team effort.
Okay, and I think we are going to have to reschedule Susan separately because unfortunately they're having some IT issues on her network, and she's not able to dial in. So with that, Maryann, do you have anything else you'd like to share with our audience? And I will stay here and see if we get any more questions from our audience. But if there's anything else you'd like to share with them about your experience or anything else, please feel free to do that.
I think I've covered it pretty well, but I'm more than willing to answer any other questions about our experience.
Okay, I do have another question here from Mr. Maxwell. He's asking about the largest implementation for the number of beds that BioVigil has executed. I'm guessing that's at one time. And I'll answer that, and that's over 450 beds, Frank. And as a tag on, Maryann, he would like to understand how your experience transfers to larger facilities. Though I don't know that we'll be able to segue since Maryann is only speaking for herself, but we do have people from other facilities, Frank, who we can get you in touch with. There are other webinars that are online that you can listen to from larger facilities, especially Lutheran Medical Center. That's a webinar that we did earlier this year. So I'm more than happy to contact you after our session is over today and get you in touch with the people with whom you'd like to speak. Any other questions from our audience? Okay, well, it's been a real pleasure. Maryann, thank you so much for joining us and for sharing your experience of how you increased your customer satisfaction at Bingham. And as I said, Susan, we will reschedule a separate webinar for Susan, and I will be emailing that out to you. This webinar, it has been recorded, and we'll be able to send the link out, and it will be posted online. As well, if you haven't checked out the case studies, there's one each from Bingham Memorial as well as from San Gorgonio. These are available on the link that I'm sharing with you now. And you just look for, if you scroll down the page and you look for the section that says BioVigil Works, there'll be a scrolling bar where you can download those case studies and read them when time permits for you. So with that, I will close our session. If anyone has any further questions, you can feel free to contact me directly, and I will make sure that your question is answered or directed to the person who can best answer that question for you. Thanks so much for joining BioVigil's webinar series, and we wish you a great weekend.
Thanks for having me, Amanda.
Thank you, Maryann.